Welcome to a new episode of Let's Talk Cancer, the podcast where we explore the latest developments, stories, and insights in cancer control worldwide. I'm your host, Cary Adams, the CEO of the Union for International Cancer Control, an organisation that unites and supports the cancer community to reduce the global cancer burden. In this episode, we focus on a key driver of equity in cancer control: health system strengthening needed to ensure that essential medicines, treatment, and diagnostics reach the right people at the right time, safely, affordably, and consistently. Our guest is Dr. Jackson Orem, Executive Director of the Uganda Cancer Institute, a UIC member organisation and the National Referral Cancer Centre in Uganda. Dr. Orem is a medical oncologist trained at Makerere University and the Karolinska Institute, and he has led the Institute's expansion in cancer treatment, research, and international partnerships, contributing significantly to cancer care in Uganda and across East Africa. UCI also collaborates with the UICC-led Access to Oncology Medicines coalition. Today, we will discuss the current landscape of cancer care in Uganda and the wider region. What does it take to strengthen cancer services sustainably? And how can collaborative partnerships support countries to build the systems, the skills, make the financing required to improve access to quality assured treatment, diagnostics for all patients? Jackson, it's absolutely great to have you on this podcast. So thank you very much for making your time. Perhaps you could just start by sharing a little about your journey in oncology.
Thank you very much for that question. I was one of those who kind of joined medical school during the advent of HIV. That was in the 80s. And then, of course, the 90s. That is when now I started practicing. One of the clear signs in those days that you could see was just words full of nothing but HIV patients. But by the time I became a practicing physician, one of the questions which came to my mind was about what about the other conditions? Because I started noticing that alongside the HIV patients, there were also, other problems, and the most prominent was cancer. Yeah, I noticed that we are having a double burden of problems. But the irony is that most of the focus was really on nothing but HIV and the related conditions, be it tuberculosis and all the others. So I kind of purpose that I think I need to tackle this other problem as well. So that is how I kind of ended up doing oncology for my specialty.
Well, on behalf of the cancer community, can I say thank you for making that decision so many years ago? We really appreciate it. And of course, the Uganda Cancer Institute is a great organization. So what is the mandate of the organization? What actually do you do?
The mandate of the Uganda Cancer Institute, as an agency, I would call it, of the government of Uganda, is to coordinate all activities related to cancer training, cancer research, as well as care. And actually, that mandate specifically is conferred on the Institute through an act of Parliament. And that has really helped a lot in strengthening the capacity of the Institute. But of most importance is so that it has the independence of mobilization of resources, and then also charting clinical as well as policy direction and guiding the Ministry of Health in as far as cancer is concerned. And I think that was done on purpose by our government, given that the priority, as well as, of course, most of the funding and support is going towards communicable diseases, and then, of course, maternal and child health and all that. That meant that conditions like cancers needed to look for some other innovative ways of gaining support.
That's great. I mean, it's important. I mean, we, from a UIC perspective, we recommend that all of government are involved in cancer treatment, cancer control. I mean, it's got to be like that, from finance, education, the trade, agriculture. I mean, it's important that there's cross government support for the ambition to improve cancer control in the country. Well, let's talk about Uganda itself then. So you've got a population of 50 million. What is the cancer challenge that you're facing there?
The biggest challenge that we are facing is that for a very long time, just like in most developing countries in sub-Saharan Africa or in Africa in general, these are conditions that for a very long time were not prioritized. They were not even recognized as a problem. And that's why in most of the dialects of our people, you hardly will find a terminology that will actually define cancer. So, of course, that means that most conditions that kind of could not be diagnosed in terms of what people commonly know, then you begin to think about cancer. So that leads to, in the first place, late presentation. And that late presentation is not just a result of the patients, but it is also a result of the system itself. Because if a system is focused on other problems, and then, of course, cancer or the non-communicable diseases come as an afterthought. That means that the diagnosis comes after a very long process. That is one of the biggest challenge. Of course, that is now coupled to also, as I said, if something is not prioritized, that means it's not planned for, and that means it doesn't have the resources that it requires. The third issue is coupled to what I said earlier. If there is a condition that doesn't have a name, that means people do not know. So there is the issue of lack of awareness is actually a very big factor. About 2002, only about 3% of the population knew that, there is a problem called cancer. But that is changing. I think we are beginning to see a turnaround somehow, as I said, with the increasing level of awareness, and then also increasing investment by our government, and then, of course, also now collaborative work that is coming up. And I think the future looks at least quite promising.
Of course, if you improve awareness and you get early stage presentation, then you have to get them into treatment as quickly as possible. And treatment is obviously more cost effective at early stage than it is later stage. What's the issue that we see across many sub-Saharan African countries is the availability of medicines, radiotherapy, and things like that. What's it like in Uganda?
You have to kind of step a little back and then say what should have been done to kind of make diagnosis effective, and then, of course, also treatment itself being effective. You'll find that the key three modalities that should have been prioritized, that is surgery, radiotherapy, and to some extent chemotherapy, and then, of course, if you add to it palliative care, should have been well aligned much earlier. So what I can say is that it all depends on the different countries. Like, for instance, in Uganda, something which happened, which I would say was the trigger, which also made, I would say to some extent, also our government as well as institutions, including the Ministry of Health, to be fairly acutely aware about cancer, is that there were earlier research work that were done in the country from the 50s and then the 60s. You do remember very well the discovery of Burkitt's lymphoma, and then, of course, stating that this is a childhood cancer and all. So that raised a lot of questions among people in the academic, I would say, arena. And then, of course, that eventually led to the establishment of the Uganda Cancer Institute. The fact that there was first a lot of emphasis on treatment led eventually to development of interest in how effective this treatment should be. And then the question of, if we put in a lot of money in just treatment alone, what is going to be the impact? And that raised now the interest of saying, look, wait a minute, why don't we try to make everything comprehensive so that we look at an holistic picture? And that is why when you come to the Uganda Cancer Institute, you find that we are doing things a little different from other countries, because in other countries, they kind of continued along that trajectory of looking at just the individual modalities, but we are looking at how can all these kind of work together in a comprehensive manner. And one of the most exciting aspects, which I'm really very proud about, is that we have also now thought about how can we include the community.
From a UIC perspective, we are focusing on drugs and medicines at the moment because we believe that there's a shortage of core basic essential medicines for cancer and around the world, particularly in low and middle income countries. So we're engaging obviously with Uganda and many other countries at the moment, saying how can we help to get medicines in there. But I guess, if I look at the International Atomic Energy Agency, they're working on radiotherapy with their Rays of Hope program, seeing if they can improve access to radiotherapy in countries around the world. I hope that though all of those initiatives help you and your colleagues, put in that holistic support that you want to put in for patients who are diagnosed with cancer early. Let's talk about diagnostics. Diagnostics often comes onto the table as being a big issue in lower middle income countries, actually more generally, I suppose. But is diagnostics an issue? I mean, diagnosing cancers in Uganda, is that a problem for you?
Actually, that is one of the things we noticed from the onset as being a major problem. And we decided that, we need to make sure that, we kind of spend some resources alongside treatment for diagnostic. And let me just give you a practical approach that we did. When we went looking for funding for drugs from the government, we noticed from the word go that they were not very keen on putting money into diagnostic, because they thought that a lot of money was already being put into diagnosis for HIV, malaria, and also what we did was to embed what we felt was going to be used towards setting up our own diagnostic system within the budget for the drugs. And actually, it has worked very beautifully, because now we coupled the diagnostic and actually drug working together. And going back to government, we are stating that, the good outcome that you are seeing, that you are beginning to witness, is because treatment goes hand in hand with diagnostics. We actually got some support from some philanthropic organization. I think we did get some money through the support of UICC, and we have set up a very nice diagnostic laboratory that now actually can even do immunohistochemistry and some of the other molecular testing and all that kind of thing, and making life very easy for our patients.
That was a great story, and there's a lot of learning there. Of course, the other challenge is the professional human resources, the oncologists, the nurses, the pathologists, and things like that. We often hear that there's a real shortage of those skills, and it takes a long time to train them up as well. So, how are you facing that challenge, Jackson?
As you know very well, the earlier specialists like myself, you needed to kind of go outside of the country, and it's usually a very long process and not very very easy, and it's very costly. So one of the areas that we are now investing very heavily in is developing our own training capacity. For instance, for the oncologists now, we do have a number of training programs in all the different areas. So we do have in pediatric oncology, medical oncology, radiation oncology, we have just started. And then the surgical disciplines have also come up with some of the areas which previously I had not even thought we needed actually, but now we do have a Euro oncology fellowship and then also a head and neck fellowship because of the demand. So for the nurses, we are actually trying also to develop similar programs as well as for the other supportive staff. What is key is to make sure that there's specialization in all the areas, and then making sure that there is a good coordination so that we have I would call it a truly multidisciplinary team. One recent addition we have added to all that is actually to make sure that the patients themselves are aware about all that is going on. It's not just communication among the different specialists, but the patients should also be knowing, what all this mean in as far as they are concerned. So there is a growing awareness about need for patient navigation, and we have been working with the American Cancer Society, and we have developed a very unique patient navigation program.
I'm a great admirer of the American Cancer Society. They've done some tremendous work in cancer, not just in America, but around the world over many decades. So some great people. Thinking more broadly, Jackson, we've talked about Uganda. What about the region itself, the challenges faced by the region itself? Are there any key things which you think the international community should know that Uganda and other countries in your region are facing?
The first one that just come to my mind immediately is currently the fact that there is instability in a number of the countries around. Then there's lack of functions of government, and the worst to be affected is health. And if health is affected, you can imagine what would be the plight of cancer patients. A good number of the patients who are coming to Uganda, and in particular to the Uganda Cancer Institute, are actually coming from that background, be it from Congo, Sudan, and of course, many of the other countries. But of course, the other issue, even though in an era of stability, even if countries are developing, there is still need for capacity in as far as care is concerned, and particularly for cancer. And I want to really give credit to our leadership here in our region, the East African region, where we have the regional blocking called the East African Community. Our leaders thought about approaching non-communicable diseases together. So they decided to have a model they call centers of excellence. So what they did was to say each of the countries in the region, in as far as non-communicable diseases is concerned, should be having some comparative advantage compared to others. And with that now, whatever advantage you have in an area, you kind of take lead in as far as the region is concerned. So we were privileged that because of the long history and some of the work that we have already done in Uganda and the approach that we are taking, the Uganda Cancer Institute has been designated as the East Africa Center of Excellence in as far as oncology or cancer medicine is concerned. In that, our role is really to make sure that we help with development of best practices in areas like, for instance, cancer registration, or cancer materials or guidelines for early detection, for treatment, and then we share with the other member states. And of course, we also provide training opportunities. For instance, the fellowship training programs that I told you about earlier is quite popular within the region. We do have students coming from Tanzania, from Kenya, from Rwanda, from Burundi, that training here at the Uganda Cancer Institute. And you'll be even surprised that, the popularity has also gone beyond the East African Community region. Right now, I do have trainees coming from as far as Malawi. Some are coming from Cameroon, or from Congo. So you can see that, the borders is not really a limitation, because the problems are quite similar.
Jackson, we're getting to the end of the podcast, but I guess I've got to ask the question. You explained beautifully in the 1990s, when you were the exception to the rule, the one going in oncology when everyone was going into infectious diseases from medical school. And you've described, where you are today, a leader, not just in Uganda, but in the region. I think you made the right decision, but tell me, what do you think about that career?
Well, I think I would say that if I'm given the chance to go back and then make a choice again, I'll do the same. I think to me, it was really the right thing that I did, and I'm so proud about it. I can see that, every step there has been some outcome that I can kind of put my finger on and say, yes, this has come as a result of this decision. And I think it added very beautifully to the earlier work that were done, especially here at the Uganda Cancer Institute. You do remember some famous names like John Ziegler. You remember people like Charles Olwenyi, Edward Mbide. These are big, big names. And one good thing they did was they built the foundation. And I think I am so privileged that I am actually building even on those foundations that they did. And the country, I think, is the beneficiary of it all, and not only the country, but the region. Because what is happening here at the Uganda Cancer Institute is very exemplary. And also, it is something which can actually be replicated. And our doors are open for our other colleagues from the region to kind of come and learn from it.
Well, Jackson, thank you very much for inspiring us with your story. It's been fantastic to talk to you, and I wish you the very best of luck in everything that you do in the future. So thank you very much indeed.
Thank you. Thank you very much.
Thank you for listening to this episode of Let's Talk Cancer. If you like this podcast, please give us a rating and subscribe to more content every month. And if you want to know more about UICC's work, visit uicc.org or follow us on social media. The topic of access to medicines and others that have been covered in this particular podcast are actually integrated into the UICC's World Cancer Congress, which is taking place in Hong Kong. So if you're interested, then register and come along and talk to me and talk to my team about the challenges that you see in your country. And thank you very much for listening, and I'll see you again soon.